Good evening. I'm John Bailey. This is People to be Heard, the program where people who have something to say have their say. Tonight, you've got the flu, the disease which is ravaging New York State. Doctors' appointments to treat patients suffering from the flu have gone up 200% in 1 year, according to state statistics. This week, Westchester County Executive George Latimer and the Westchester Commissioner of Health, Dr. Sherlita Amler, held a news conference at the Department of Health to focus on the flu epidemic in Westchester County. Their message is that Westchester County residents need to get flu shots now for themselves and their children. Why? Because if you've already been exposed to the flu, the vaccine can abate the symptoms, making your case of the flu less severe and those of your children or loved ones. They made the case that you cannot get the flu from the vaccine, and if you do get the flu after a shot, it is because you were already exposed before you got the shot. How do you get a flu shot? Well, you can get one free at the Department of Health by making an appointment by calling the department 914-995-5800, 914-995-5800. Pharmacies are also giving flu vaccinations, and you can find a list of those pharmacies at the Health Department website, www.westchestergov.com/health, www.westchestergov.com/health. Now, why did the county executive go for a flu shot? He began the flu news conference this way. Let's go to the videotape.
I'm here today to do something that every Westchester resident should do. And I'm here today because, like many Westchester residents, I have been lazy and stupid in not doing it already. And that is getting a flu shot to give myself the best possible protection in what is a very intense flu season. Dr. Sherlita Amler, who is our Commissioner of Public Health, will discuss a little bit of the backdrop of this. But even as a layman, I know that a flu shot will give me the best possible protection against what's happening out there. And this applies really to everybody in the family. Now, I'm 64 years of age, so those who are a little bit older are even more vulnerable. Those obviously at the other end of the spectrum are younger. But there is an opportunity for you to protect yourself and your family by making sure you do the same thing that I'm about to do, which is get a flu shot. The flu vaccines are offered through Westchester County Department of Health at our various clinics, whether White Plains or Yonkers. Dr. Amler will outline that in a second. This is the greatest time of the season to be worried about the flu, because I'm told this is a very intense flu season. It may last a little longer than has been expected in the past. So even though we're having this conversation in January, it is still a timely thing to do, and we should do it. I understand that we've given out 1,400 flu shots at this point, and that's a significant amount, but there are almost 1 million people in Westchester County. So the liability here is tremendous for those of us who should do it. There are flu vaccines offered at supermarkets, at your local doctor's offices, but again, you can make an appointment at White Plains or Yonkers with the County Department of Health and get a flu shot through here. If you'd like more information, you can go on our website at www.westchestergov.com/health to get more information. Roughly speaking, Westchester gets about 90,000 cases of influenza during the flu season. And it can run until late May, and again, we have some discussion that this season might run into June. And so there's a host of issues going on statewide. The governor and other officials have highlighted this, so we here in Westchester should do what we could do. There are a lot of different symptoms for when the flu strikes, and so the best thing to do is not worry about the symptoms, but try to get the flu shot early on, and of course do all of the intelligent things we know to do. Wash our hands frequently, make sure that when we cough, to do it in a way that's appropriate so we don't spread our germs to other individuals. And whenever we get any of the symptoms, immediately see the medical professional so that you can have the right type of health care. I will say candidly, like many individuals out there, and I'm going to finger people in my own gender, many men who don't respond preventively the way we should on our own health care. I'm as guilty as other people. So if this applies to you as well, then think ahead and try to do some preventive work, particularly in the season. You don't want to get the flu, you don't want to give it to other people, and you don't want to have to suffer through it if you can. With that, I'm going to have Dr. Ambler, our Commissioner of Health, share a few thoughts, and I'm going to stop talking and take my medicine.
Mr. Latimer brought in Dr. Sharita Ambler, Commissioner of the Department of Health, who presented an overview of the flu situation in Westchester County this week, and that you should take it seriously. She advised the necessity of seeking care when you experience the symptoms and pointed out how you, as a caregiver of a child or a husband or wife who has the flu, can get a medication that can prevent you from catching the disease. The flu is not a disease to allow getting worse before treatment. People die from it. She was emphatic that you should not tough it out and try to go to work because you can spread the disease. She explains about how you can get flu shots without insurance and talked about immunizations every Friday at Department of Health locations.
So, flu is with us every single year, and because of that, most people think that it's just a non-event. But the reality is that more people actually die of influenza than of all other vaccine preventable diseases combined. So how can you keep yourself and your families safe? Well, number one, get your flu shot. We can vaccinate anyone older than 6 months of age. Number two, if you do get a fever, malaise, just hurt all over, might have a little sore throat, cough, don't go to work. Don't send your children to school because we don't want them infecting other people. Stay home. You call your doctor. There is a drug that can be given if it's given early in the course of illness, usually within 24 to 48 hours, that can reduce the amount of time that you are ill with the flu. So if you have the flu, give your doctor a call and get treated. This is especially important for children. There have been 37 children who have died of influenza this year, healthy children. So this does not just impact the elderly, it also impacts the people that we care about the most, and that's our children. So again, best advice is not too late to get your flu shot. If your children and yourself have not been given a flu vaccine, please call your doctor. I know that we're hearing that there are some pediatric offices that are out of flu vaccine, but that doesn't mean there's a shortage. We have actually been reaching out to providers, and there is flu vaccine available in our community. State website, state health department has on their website, and I believe we have it on ours too, a link that you can go to see where in your community flu shots are available. We will be giving influenza flu shots here to individuals who have either no insurance or their insurance doesn't cover flu shots. We do that on Friday. We give a variety of immunizations to people who have no insurance. But we hold immunization clinics here in this clinic every Friday. The governor has also made it possible through an executive order for pharmacies now to be able to give flu shots to individuals 2 years of age and older. In the past, pharmacies were only able to give adults flu shots. So now you can call your local pharmacy and see if they have available vaccine. So my best advice is if you haven't been immunized, again, get immunized. If you get sick, you think you have the flu, don't expose others, and call your doctor and see if Tamiflu or an antiviral drug might be appropriate for you. Thank you.
You're watching a People to Be Heard special report on the flu in Westchester County, telecasting a news conference that was held Tuesday with Westchester County Executive George Latimer and County Commissioner of Health Dr. Sharita Ambler on the state of the flu in Westchester County, USA. As we rejoin the news conference, Mr. Latimer opens up the news conference to reporters. They asked intelligent questions that revealed more about the disease everybody talks about but knows little about, so that you will know more how to cope with it. And remember to call to get your flu shots for your family. Contact the health department at 914-995-5800, or for pharmacies that will give you the flu shot, go to www.westchester.gov census.gov/health. The questioning revealed that the flu seemed to become a disease not to fear, but can be coped with through the simple task of getting a shot and taking on the suffering with medical intervention right away. We also, in this segment of the press conference, they talk about when to go to the hospital and signs you should watch for. Let's go back to the news conference.
If there are any questions, we'll try to answer it now.
How severe is the flu in Westchester County?
Well, we've been very lucky. We've had no pediatric deaths in Westchester so far this season. We want to keep it that way, of course. We are having influenza reported in assisted and independent living facilities, in some of our daycares. I understand, that we've had a number of people hospitalized with influenza this season. So we certainly have the flu. We certainly need people to take this seriously. And like I said, your best protection. A lot of people will tell me, well, I'm afraid to take the flu shot because I'm afraid it'll give me the flu. It's impossible. This is a killed vaccine. It cannot give you the flu. But what can be happening is you could already have been exposed to the flu by the time you get your flu shot, and you might still go on to get the flu. What the flu shot hopefully will do, and the major reason you should get it, is that it can help reduce the severe complications of influenza and hopefully even death. So that's the major reason to get your flu shot, is that, if you look at some of the recent studies, there's definitely been some studies that have shown a reduction in the incidence of severe complications in people who have had a flu shot.
We've heard some cases where seemingly very healthy people have died very suddenly.
Absolutely.
Because of this.
I have people all the time who tell me, well, I'm not old, I don't have any medical problems, why should I take a flu shot? Unfortunately, I can't look at you and tell you that if you get influenza, you're going to be okay. If we knew who was going to die from it, of course we would make sure that they were immunized. The fact of the matter is, we don't know who will have a bad outcome. So that's the reason that everyone needs to be vaccinated for flu every year.
Why is this year's flu so much more serious and devastating?
Well, I don't know that it's the numbers, tend to be a little bit higher, but the real issue was it started earlier. We started seeing influenza earlier than we typically do, and we are seeing both influenza A and B circulating in our community. I think that has a lot to do with it.
I see. Is there a new strain this year?
No, I mean, the strains that we're seeing are ones that have been known to us in the past. They're largely ones that are covered in the vaccine. As you know, influenza vaccine doesn't just cover for one strain of influenza. There are flu vaccines that will cover either 2 or 4 strains of influenza. So they cover both for A and B.
County Executive, why did you wait so long to get your flu shot?
Well, I think it's nothing that is particularly admirable. I was lazy. I had other things that I thought were more important, but clearly it's not. And so hopefully my experience is what the experience of other people is right now, which is do the smart thing. If you haven't done the smart thing yet, now's a good time to do it. I had the opportunity to see a couple of our nurses who work here in Westchester County a few nights ago, Lori, who's here, Susan, who just walked in the door, and they admonished me when they found out that I hadn't had the flu shot. So when everybody around you is telling you what you ought to do and they're giving you good advice, then you ought to do it. That's why I'm here today.
Have you ever had the flu before?
I've had flu shots before. I've never had influenza before. But as I mentioned before, my age, I turned 64 late last year. And you do begin to be more concerned the older you get. And clearly I'm not in the best of physical shape. I don't feel ill or anything. But you need to be prudent. And I think that's really what this is about. For the medical professionals, they understand the impact of this. Everyday people just do what's intelligent. You know that this is flu season. You know that the flu shot has a great potential of reducing your likelihood of getting it. Nothing is guaranteed in this world, this shot nor anything else. But this is the smart thing to do. And after probably a month or 2 of not doing the smart thing, I'm here to do the smart thing.
And for the Commissioner, are the schools in the county doing enough to protect students against the flu? Is there anything, are you guys advising any of the local schools?
Well, I don't think the basic measures are really within the purview of the school. I mean, it's really on the parents to make sure their children are vaccinated. And it's also on the parents to not send ill children to school. And hopefully if we don't have illness coming into the school, it won't be a problem for the school. Once it's there, you know, and if there's widespread influenza in the school, then it becomes an issue for the school districts to deal with. But the prep work for all this, the important things, lie in the hands of the parents.
How long does the flu usually last once you get it, and at what point should you consider hospitalization?
Well, I mean, in some of the instances of healthy people you've been hearing about, you know, unfortunately, they died within days of becoming ill. That's not the general course. Most people may have a cough, like I said, they may have a fever, they may just feel tired, they may feel achy all over. Those are common flu symptoms. But it's when the fever is very high and they don't seem to be improving. Or if it's a child, I think a call to the physician is warranted. And like I said, there are drugs that if you call your doctor early and say, you know, I really think I have the flu, they may or may not want you to come in. That's their decision. But they might want to call in an antiviral medication to help the disease last shorter time and to prevent complications. And that drug can also be used as a preventative measure. So let's say you have a family member that has influenza and you're in close proximity, maybe you're a caregiver for that individual and you don't want to get the flu, you can call your doctor. They can prescribe Tamiflu as a preventative measure so that individuals who are exposed may not go on to get influenza, or if they do, the symptoms might be less.
That left one more task: administering the flu shot to the county executive. Dr. Amler said she had washed her hands 3 times, but still applied cleansing lotion to her hands while Mr. Latimer rolled up his left sleeve. Dr. Ambler advised that hard surfaces in your home, like doorknobs, should be disinfected with bleach or a germ-killing cleaner. Environmentally friendly cleaning products, she said, often aren't strong enough to kill germs. Dr. Ambler advised to clean high-touch, hard surfaces with a bleach solution. Add a tablespoon of bleach to a gallon of water. Pour it into a spray bottle and use it to clean countertops and tables, railings, and doorknobs. But don't use it on upholstered furniture, of course. In preparing meals, you should try to avoid preparing food for others, and don't share utensils if you yourself have the flu. Just as you, if you have the flu, should not go to work or send a flu-stricken child to school, you should keep your distance from people who are sick, because flu virus spreads through the air when a sick person breathes, speaks, or coughs. You should stay home with the flu until you are fever-free, Dr. Ambler said, without medication for 24 hours. Now, let's take a look at Mr. Latimer getting his shot.
You have the right angle. I'll move.
Yeah, you're fine. And that's it.
Not too bad.
You've been watching a news conference on the flu in Westchester County, held this week, January 30th, 2018, with County Executive George Latimer and County Commissioner of Health, Dr. Shirlita Ambler, talking the flu and what you need to know about how to prepare for it, get a flu shot, and here are some of the neighborhood health centers you can call to see about when and where you can get a flu shot or consult your family physician. I leave you now with the list of neighborhood centers. This is John Bailey for People to be Heard. Good night.